What does it mean if an autistic child stops talking? Imagine watching a child who once happily chatted and then suddenly becomes silent. It can be confusing and even worrying for parents and caregivers. When an autistic child stops talking, it might be a sign of something called language regression. This is when a child who previously developed speech skills begins to lose them, either partially or completely. This change can happen quickly or gradually, often between the ages of 15 and 30 months. Some people refer to this as regressive autism, a type of autism spectrum disorder where children lose skills they had already gained, like talking, social skills, or motor abilities. Scientists aren't entirely sure why this happens, but they think it involves a mix of genetic and environmental factors. It's important to remember that losing speech does not mean the child will never speak again. Many children who experience speech loss later develop phrases or even fluent speech as they grow older, sometimes by age 8 or beyond. There are several reasons why an autistic child might stop talking. One common reason is speech and language delays related to autism. Many autistic children have trouble with communication and social interaction, which can show up as delayed speech or losing speech skills. These delays might be caused by difficulties in oral motor control, which is how the mouth moves to produce speech, or auditory processing issues, which affect how the brain interprets sounds. Neurological differences can also play a role. Oral motor disorders like apraxia of speech, where planning and coordinating mouth movements is hard, or dysarthria, which causes muscle weakness affecting speech clarity, can cause speech to become difficult or stop altogether. Some children also have trouble processing spoken language, making it hard to understand or produce speech. Communication frustration can also be a factor. When a child cannot express what they need or feel, they might become overwhelmed or withdraw from speaking. Autism often involves social communication challenges, which can lead to behaviors like echolalia, where children repeat words or phrases without meaning to communicate, or a preference for nonverbal ways of sharing their feelings. It's important to distinguish between speech delay and autism. Not all children who stop talking or have delays are autistic, and not all autistic children lose speech. Some may never develop spoken language but find other ways to communicate effectively, like using pictures or sign language. If a child who previously spoke suddenly stops, it's a sign that a professional evaluation is needed. Early screening and diagnosis are key to understanding what's happening. A team experienced in autism and developmental disorders can assess the child's skills and determine if regression is present. Early intervention, such as speech therapy or behavioral therapy, can help support the child's communication development. In summary, if an autistic child stops talking, it can be a sign of regressive autism or related communication challenges. It reflects differences in brain development that affect speech and social skills. With the right support and therapies, many children can regain or develop new ways to communicate as they grow. Recognizing these signs early can make a big difference in helping the child reach their full potential.